Hi, I'm Dr. Michael Kemper. I'm a urologist with Georgia Urology. I see patients out of the Decatur and Conyers offices. I practice general urology with a focus in men's health. I treat patients with erectile dysfunction, incontinence, both male and female, urinary symptoms from an enlarged prostate, kidney stones, as well as initial diagnosis of prostate cancer and bladder cancer. I grew up just outside of Boston, Massachusetts. I went to University of Michigan for undergrad, and then I did my medical school up in Albany, New York. Came down to Augusta at Medical College of Georgia for my urology training, and then I did 1 year in Miami doing a men's health fellowship before I came out here to Georgia Urology. My primary focus is on penile implant surgery. I also do a lot of enlarged prostate surgeries with Greenlight laser, Urolift, and Aquablation. I also treat female incontinence with Bulkamid as well as with Axonics for overactive bladder. I joined Georgia Urology because it's a practice that would allow me to do the work that I'm passionate in an area with a patient population that I'm passionate about for a large private practice group, mainly because I like having a certain amount of control over my practice and what I'm doing, because I have certain things that I really am passionate about putting forward and treating. And that's not necessarily something you get to do everywhere in terms of how you build your patients and your patient population and your patient selection. That was it ended up being a very good fit in terms of they needed someone in that area who had my skill set, and I liked the area, Atlanta, but also just Decatur, and that Decatur sort of east corridor ended up fitting very well. It's a large enough group that we have resources that you can do whatever you would like, and patients can get treated regardless of the problem that they have, either by myself, or if you don't have, if I don't take care of a problem, I know one of my partners can, and I can bounce my ideas or get suggestions or talk about patient care with a very large group of super competent urologists. But it's small enough that it's not a gigantic hospital system, and you get that level of ownership of your patient and of their disease state and of their problem. They're not something that you can pass on. It's not something that is sort of faceless. It's a group where you can talk to exactly who, I can talk to the person who runs the practice every single day if I want to. I can talk to the people, all across Atlanta in our entire group, and we're all a phone call or an email away, and they're very responsive.